And we now come to statement. Secretary of State for Health, Victoria Atkins.
Thank you, Madam Deputy Speaker. It is, with permission, I would like to make a statement on this government's work in the National Health Service. I'd like to start by, first of all, paying tribute to my honourable friend, the Honourable Member for South Thanet. I've warned him I'm going to be referencing him, welcome him back both to this place and to say that his magnificent question yesterday in PMQs was an absolute tribute to him and to his family, but also, of course, to the National Health Service, who have done so much to put him back together, and his commitment to public service and dignity in the face of adversity is not only inspiring but an example to us all. And I want to make this commitment to him that as Secretary of State I am determined to change the prosthetics policy to support quadruple amputees such as my honourable friend. He makes the point passionately and I have heard him. But I also want to start by reassuring the victims and families of the infected blood scandal that the general election that the Prime Minister called yesterday will in no way affect the process that is already underway. Throughout the election period, government officials and I will continue to study the report to make sure that the lessons of Sir Brian's inquiry are learned and that these mistakes can never be repeated. And we will work with the NHS Business Services Authority to make sure that everyone who is eligible receives the second interim payment of £210,000 over the summer. The report lays bare the many failings of successive governments, including historic failings in my own department. As Secretary of State, I apologise unreservedly for the actions that have hurt and harmed so many people. And I know that there is consensus in this House that we will work together to ensure that nothing like this ever happens in our country again. Now, Madam Deputy Speaker, I last updated the House in January, and I would like to use this opportunity to share the steps we've taken since then to make our NHS faster, simpler and fairer for patients and staff. In 2019, we promised 50 million more GP appointments a year, and thanks to the hard work of our GPs and their teams, we have delivered that promise. In January, we went further by launching our Pharmacy First programme, which empowers pharmacists to prescribe medication for 7 common conditions without the need to see a GP. We are seeing really encouraging numbers of people using it, and when it is at full power, this will free up to 10 million GP appointments. And in the face of industrial action, we have reduced the NHS waiting list by more than 200,000 since September. Outside of the pandemic, we have delivered the biggest 6-month fall in the waiting list in more than a decade, with waiting lists falling for 6 months on the bounce. And through our new hospitals programme, we committed to delivering 40 new hospitals by 2030. I'm pleased to tell the House that 6 hospitals are now open to patients, 2 more are expected to open by the end of the financial year, and 18 more are in construction. We've launched a recovery plan for dentistry that will create 2.5 million new NHS appointments this year alone. It is doing this by giving dental practices extra cash for new patients that they see, introducing golden hellos and deploying dental vans to isolated rural and coastal communities. And since I launched our recovery plan, more than 500 additional practices have opened their doors to NHS patients. Today, we're going further by publishing a consultation on introducing a tie-in for graduate dentists, which will commit them to a period of NHS work where they can hone their skills, develop a breadth of experience, and give back to the people who have helped to fund their training. We know it costs the taxpayer up to £200,000 to train a dentist, and we think it is right and fair to ask new graduates to use their new skills in the NHS. Now, ensuring the NHS works for women is one of my priorities, and we've taken a number of steps to support them. We are opening women's health hubs across England. We're helping 50,000 bereaved parents acknowledge their beloved baby with baby loss certificates. And we've helped 500,000 women to get cheaper HRT. We're also rolling out new maternal mental health services for new mums, which are already available in all but 3 local health systems. And we're looking to tackle conditions that disproportionately affect the female population, like osteoporosis. Every year in England, some 67,000 fractures are suffered by people of working age, a majority of whom are women, and many of them are entirely preventable. I've listened to the tireless campaigning of the Royal Osteoporosis Society and the campaigns of the Express and the Mail on Sunday, and so today I want to confirm that this government has the ambition to expand the use of fracture liaison services to every integrated care board in England and achieve 100% coverage by 2030. I've also made it my priority to protect our children who have been questioning their identity in ever-increasing numbers. The Cass review laid bare the damaging effect that social media and degrading pornography has had on young people's sense of self. It has also set out clearly the need for extreme caution in medical interventions. Today, I want to set out my clear intention to introduce a banning order on puberty blockers with limited exceptions under Section 62 of the Medicines Act 1968. This is an extraordinary use of that power, but it is the right use of that power because we must protect our children and young people from this risk to their safety. Now, Mr. Speaker, Madam Deputy Speaker, we know, forgive me, that to make the NHS sustainable in the long term, we need to work on prevention, not just cure. To drive this progress, we need to embed prevention within the structures of the National Health Service and government. That's why we will be benchmarking, identifying and publishing health service prevention spending. And to support investment in prevention, NHS England and DHSC, my department, will work closely with integrated care systems to develop practical information and evidence that will aid local investment decisions. As Secretary of State, I've seen how prevention tests across the NHS are not joined up, and I want to make the NHS app the front door for prevention as well as cure. By 2026, people across England will be able to book vaccinations for 16 preventable diseases, including MMR and the HPV virus, on our app. And this move will make sure that millions more people receive the vital vaccines we all need, not just saving them from life-threatening conditions, but also saving the NHS money and resources in the long term. We also have a duty to give families the information they need to make healthy choices. There's been a lot of talk about the potential damages of ultra-processed foods, including in the press recently. We want to cut through the noise and give you the facts. That is why I have asked our National Institute for Health and Care Research to gather evidence on the impacts of ultra-processed foods on health to help us support people to make informed and healthy choices. In conclusion, Madam Deputy Speaker, when it comes to the NHS, this government has a record to be proud of. We have 50,000 more nurses, 60 million more GP appointments, 7 million tests, checks and scans at community diagnostic centres. We have waiting lists coming down. We have more dental appointments available. We have better care for women, more protection for vulnerable young people. We have the first ever long-term workforce plan and more doctors, dentists and nurses than ever before. We have a clear plan and we are taking bold action to build a secure future for our National Health Service.
Shadow Secretary of State, West Streeting.
Thank you, Madam Deputy Speaker. Let me just start with a few points of genuine consensus. Firstly, I associate myself and my party wholeheartedly with her remarks about the member for South Thanet and the extraordinary courage and strength he has shown. I also really welcome what she said in terms of reassurance to victims of the contaminated blood scandal and the emphasis on the cross-party commitment to continue at pace to deliver justice, whatever the outcome of the general election. And I also welcome what she said about the justifiably cautious and responsible approach she's taking in relation to puberty blockers in light of the CAS review too. End of the consensus, Madam Deputy Speaker, because after 14 years of Conservative incompetence, neglect and vandalism, the National Health Service has never been in a worse state. They cut 2,000 GPs and now it's impossible to get an appointment. They wasted billions on top-down reorganisations, recruitment agencies and crony contracts for useless PPE instead of training the workforce the NHS needs. They forced nurses out on strike for the first time in history, and now the Prime Minister shamelessly tries to blame them for his own failure, sending the country into an election with strike action still looming. He promised to cut waiting lists. They are up to 7.5 million. And even their claims that waiting lists have fallen in the last 6 months has only been achieved by excluding the community figures, fiddling the figures. He promised to build 40 new hospitals and they have failed to build a single one. And they hold people in this country in such contempt. The Conservatives think they are so stupid that the public will fall for the same recycled, soggy promise all over again. Vast swathes of the country have been left without a single NHS dentist, forcing people in Britain in 2024 to perform DIY dentistry on themselves. And after 14 years, the fundamental promise of the NHS has been broken. People can no longer be sure the NHS will be there for them when they need it. And listening to the Prime Minister's interviews this morning, it is clear he has given up on the NHS. He has called this election with no plan to cut waiting lists, no plan to end the strikes and no plan to reform the service. The Conservatives have taken the NHS to breaking point. If they are given 5 more years, they will finish the job. This election is the country's chance to turn the page on 14 years of failure and end the chaos in the NHS and rebuild our NHS. No part of our country is crying out louder for change than our health service. Not just investment, but reform. Because if the NHS is to be there for us free at the point of use for the next 75 years, as it has been in the last, it must change. And only Labour can deliver that change. Our damp squib of a Prime Minister is dripping into this election with a puddle, not a plan. In contrast, Labour has a plan to get our NHS back on its feet and make it fit for the future. They ask what it is. Give the people what they want, Madam Deputy Speaker. 40,000 extra appointments a week at evenings and weekends to cut waiting lists. Double the number of scanners with AI-enabled scanners diagnosing patients faster. 700,000 emergency dental appointments and reform of the contract to rescue NHS dentistry, doubling medical school places and training thousands more nurses, GPs and midwives, delivering Labour's workforce plan, bringing back the family doctor so patients can see the same GP each appointment, 8,500 mental health professionals to treat people on time with mental health support in every school and hubs in every community alongside landmark reform of the Mental Health Act. That's Labour's plan and that is just the start. And more than that, unlike the party opposite, we have a record on the NHS to be proud of. A record of the shortest waiting lists and the highest patient satisfaction in history. We did it before and we will do it again. And that is why representatives of the nationalist parties in Wales and Scotland know, and even admit in private, that a Labour government in Westminster will be a rising tide that lifts all ships across our United Kingdom. But I say to people, Madam Deputy Speaker, it is not enough to send MPs to Westminster to oppose the Conservatives. You need to send Labour MPs to replace the Conservatives. If they are given 5 more years, nothing will change. The chaos will continue. The NHS crisis will get worse. So as we approach this general election, be in no doubt, the only way to deliver the change our country needs is to vote Labour, and I have every hope that our country will do just that.
Well, Madam Deputy Speaker, I know that the honourable gentleman has spent a lot of time in recent days studying that infamous pledge card, and it's obviously had it's taken up a lot of space in his brain, because he seems not to have understood that not only with industrial action have we settled months ago with the consultants, so they're not on strike. Not only have we arrived at a settlement with the SAS doctors, and that's going out to ballot, but he asked about junior doctors. He's obviously missed the news that we've just entered mediation with them, and that is why we are bringing together, with the work-life plan, the progress that we're making on working conditions. That is why the Labour Party doesn't like conversations about mediation. No, because we all know they are beholden to their trade union masters and have never condemned a single strike that has affected our constituents and their access to healthcare. Now, he asked about the new hospital programme, and I was wondering whether he was going to ask me about this. It is, as some might say in politics, bold. And the reason for that being, I have taken the trouble, it was a lot of trouble, to read the Labour Party's health mission. And one of their pledges in their health mission is that one of their first steps is that the Labour government would be to pause all capital projects in the NHS. So our constituents should be clear. The Conservatives have a new hospital programme, which we are delivering. The Labour Party have a no new hospital programme. But he also talks about the ideas that he couldn't quite remember over the weekend for the NHS, the number of appointments they're going to bring. Well, I think it was appointments, because when the honourable gentleman was asked to clarify, do you mean appointments or do you mean treatments, he could not define it. And I hate to break it to the honourable gentleman, but there is a difference between an appointment and, for example, a triple heart bypass. And so I just would love to know again whether he's talking about appointments, whether he's talking about treatments, and just to help him understand the scale of NHS England's activities on a weekly basis. The NHS England provides 575,000 appointments a week for outpatient appointments. And so his pledge sounds like a big number. The truth is it won't even touch the sides, even when they've worked out where the sides are. He also bravely talks about the Cass review, and I genuinely welcome the fact that he has thrown away his long-held principles and relied on the evidence that Dr. Cass provided. But I wonder if he ought to have a conversation with his fellow shadow cabinet members, because they have announced this week a policy that is self-identification by the back door. They want GPs, they want to put the responsibility for self-identification and the gender recognition certificate process on the shoulders of our GPs, when we are clear that we want our GPs to be focusing, as we have done, on the 60 million more appointments that they are making in the last year. And so he does not understand. Forgive me, he's chuntering at me. He needs to go away and read the Act, because it is in fact a panel who look after it, but Labour are seeking to change that to make it a single GP. But he talks about the record of the Conservative Party. We are very proud of it. I'm particularly proud of the fact that we have record funding under the government for mental and physical health. But I wonder whether the honourable gentleman is quite so proud of the record in Wales. Because their record, and by the way, Labour run the NHS in Wales. I only have responsibility for England. I wish I had responsibility for Wales as well. It's going better than it is in Wales. Because the Labour-run NHS in Wales, a quarter of people are on an NHS waiting list in their part of the NHS. The highest number of patients waiting 2 years is higher in Wales than it is in England. The patients waiting on average 6 weeks longer in Labour-run Wales than in England. Mr. Speaker, Madam Deputy Speaker, if their performance was replicated here in England, waiting lists could be as much as 6 million higher. And so the choice is clear: unfunded Labour failure or a clear plan for a more secure future with the Conservatives.
Chair of the Health and Social Care Select Committee, Steve Brown.
Finally, a long-term workforce plan in place. Serious investment at last from the Chancellor on health tech in the spring budget. Really welcome, and a record to be proud of, as the Secretary of State says. But she will be aware that if demand continues to exceed supply, we have a problem. Now, my right honourable friend told us that she does indeed believe prevention is the new cure. So throughout this general election campaign, and from here on as she continues as Health Secretary, will she please bang on remorselessly about the big drivers of ill health: smoking, alcohol addiction, obesity, poor housing and bad diet? Because we can only protect the NHS, remember that, if we're a healthier society.
May I thank my honourable friend, not just for his question, which was excellent as always, but also actually for his long record in this House, but particularly in the world of healthcare. He was a superb minister in the Department of Health and now has chaired the Select Committee with great skill and has scrutinised many a minister, and we do not find that a relaxing experience, I can promise him, but I really do pay credit to him. And may I thank him also for highlighting the importance of prevention. We want to bend the demand curve on the NHS. We know that the demand has risen in recent years. We are seeing more people in A&E. We are seeing more cancer referrals. We are seeing more people accessing scans and checks and diagnostics. But we need to help people understand that we can take responsibility for our own health, and through work such as using the NHS app and using that as a gateway to prevention, I genuinely think not only will we be helping our generations, but also importantly helping younger people who sometimes get forgotten in our conversations about healthcare in this country.
Dame Diana Johnson.
Thank you, Madam Deputy Speaker. Can I welcome the commitment from the Health Secretary to paying the £210,000 interim payment for those infected under the contaminated blood scandal. But could I just say to her, there's no clarity at all from government about the payments that Sir Brine recommended in April 23 to those who've received nothing so far, the parents who've lost children and the children who've lost parents. And can I also seek from the Health Secretary a guarantee that we will see the psychological support services put in place in England immediately? They're in place in Northern Ireland, in Scotland and in Wales. And since 2020, ministers in the Department of Health have been saying that those services would be made available. That's 4 years ago. It's not acceptable. And after the statement earlier this week by the Prime Minister and by the Paymaster General, this seems to me something that the NHS could do quickly and would have enormous impact, especially because of the general election being called and now people feeling they don't quite know what's going to happen to the promises that this government have made.
May I thank the Honourable Lady for all of her work. And she may recall when the inquiry was announced by the then Prime Minister, my right honourable friend for Maidenhead, we had a debate on that matter, and I spoke as a backbencher on behalf of a constituent, and I very much hope that he and others gain some reassurance from the fact that I understand exactly the issues they have faced over many, many years, and as Health Secretary it is my responsibility and indeed my privilege to try to help them now. In relation to the compensation schemes for those who have not yet received payments, I know she will have poured through very carefully the responses of my right honourable friend, the Minister of the Cabinet Office. We want to ensure that we give the independent compensation authority, and I underline the word independent because I am very sympathetic to the sensitivities of families and victims around the part that the Department for Health and others played in their pain. So we want to give Sir Robert the chance to set the scheme up, as I say, very much assisted by the expert panel. And on the point of psychological support, I promise her this is a matter that I'm discussing with the Chief Executive of NHS England and have been for some time. We are wanting to recruit the right people to conduct that incredibly sensitive work, and it's going to take us a little bit more time, but I assure her that NHS England is acting quickly to bring those services in, we hope by the end of the summer.
Arthur of the House, Sir Peter Bottomley.
Can I thank the Secretary of State for the answer she gave to the Right Honourable Lady, and say that I hope that the letter which her department will receive from us will get a full reply. Thank you for her interim words. Can I say that I hope she'll be able to come and will be invited to come to the opening of the new Integrated Care Centre in Worthing by the Town Hall, which is a mixture of local authority enterprise carried on by the present administration in Worthing, and to say that in my constituency there has been great concern over dentistry. The pressure is coming off, but it's not coming off fast enough. We should please encourage all the people in NHS England to make sure that dentists are encouraged to provide the kinds of services which all our constituents want.
Again, may I thank my right honourable friend and congratulate him on the opening of the services he has described. I will very much look forward to attending that opening with him and with colleagues across his area. In terms of the dental recovery plan, I have set out a number of ways in which we are going to improve the delivery of dental care across England. They include immediate term, medium term and then longer term work. The immediate term work is already seeing results. So switching on the new patient premium, we are already seeing practices opening, but we very much want to bring these golden hellos forward as well, so that we're encouraging dentists into areas that do not have the services that we would like. And as I say, there was a PMQ yesterday, slightly misinformed. We are very much in the middle of tendering our dental vans, because I want, as a rural MP, I want to get services as quickly as I possibly can, whilst we're building the foundations to ensure people can get the care we need.
Stella Creasy.
Thank you, Madam Deputy Speaker, and I'm going to abuse this to say it's always been a pleasure to see you in the chair in this House, and I shall miss you terribly. Your fairness and your insight and your wit has brought colour to this chamber. Moment of consensus over. I stand here as a current Member of Parliament for a constituency that will have heard what the Secretary of State said with horror. Because for 14 years we have been desperately waiting for Whipps Cross Hospital to be redeveloped, and the Minister opposite knows that we had a meeting this morning that she had to cancel, presumably because the general election has been called, about this very point. The failed new hospital programme has cost my constituents dearly. We were told under that programme works would be finished by 2025. They haven't even started because the government still hasn't actually committed the funding, so much so that the board notes for the meeting say that they have to admit they won't even start next year, and they certainly won't be finished by 2030. What a damning indictment of this Conservative government, because what it means is that my constituents have to be treated in corridors in Whipps Cross. The physical layout of this mangled, broken building is directly impacting on the quality of care that my constituents receive. There's an amazing team at Whipps Cross doing incredible work, almost in tears at the impact it has on patient care, that we still don't have our new hospital. So will the Secretary of State answer the question that I wanted to ask her colleague this morning in the meeting that we had previously committed to? We need urgent confirmation that we can finalise the plans, that we will get the funding to build the new hospital at Whipps Cross. We can start talking to a contractor, and at least works could begin in 2026, as opposed to the works that were pledged by my Conservative colleagues in my borough that were due to start last year. That wasn't true. Will the Minister at least confirm? Will the Minister at least confirm that we will, under her plans, finally get the funding that she said would happen? Walthamstow deserves better.
Madam Deputy Speaker, may I say I had not heard the news that you had announced you were stepping down. Can I say how I share the House's dismay, but also our thanks for you sitting in the chair. It's always a pleasure. It's always a pleasure to have you in the chair, although it is a steely pleasure, because you let us know when, most of the time, when we speak too long. If I may I just say to the Honourable Lady, I'm trying to, her colleagues are trying to prevent me. In terms of the concerns about Whipps Cross, we have committed to that hospital. It takes time to build these hospitals. That's why already we have 6 open to the public. We have another 18 entering construction. I do hope, however, that she is challenging her own leadership, including the shadow member opposite, because, as I say, their own health mission, one of those missions, who knows if it's a first step or a pledge, or who knows what their terminology is, but their health mission says that one of their first steps in government would be to pause all capital projects in the NHS. That is an answer that the party opposite need to provide.
Matt Hancock.
Thank you very much, Madam Deputy Speaker. And can I add to the tribute? This is my final contribution to this House, and what I want to say, having served in the Right Honourable Lady's shoes, is I know how hard it is to deliver on manifesto commitments, delivering on 50,000 more nurses, on the GP appointments, and being on track on the 40 new hospitals is a great achievement. But can I also urge her to say a little bit more about how all of that is helped and supported by the incredible improvements in technology within the NHS we've seen over the last decade. And without those, there's no way we can bring the NHS into the to succeed in the next decade, and harnessing these extraordinary opportunities like but not only AI will stand the NHS in great stead if we can really get the data to be used properly. And with that, that's over.
My goodness me, Madam Deputy Speaker, may I start by thanking my right honourable friend. I have an inkling of the responsibilities and the pressures that he bore during the pandemic. There will be, many thoughts on aspects of how the government and indeed society handled that pandemic, but I know that my right honourable friend, devoted his absolute all to trying to keep people safe and to trying to move our society out of lockdowns, and I thank him sincerely for all of the work that he has done. And he, very much true to his character, wants to talk about the future. I know that he had a particular focus outside of the pandemic when he was Health Secretary, and indeed in other previous cabinet roles, on the role that technology can play in our lives. And the fact that our NHS app now has 3/4 of adults in England signed up to it, I think is a tribute to him, but a tribute to those people in the NHS that helped deliver this. We have more subscribers to the NHS app than Netflix. And the most common users of the NHS app are in fact people over the age of 65. And so we can see just how powerful this app can be and the role it will play in prevention. But to do that, we need to invest in the technology. And not only do I view the long-term workforce plan as a critical part of building the next 75 years of the NHS, so too is the tech plan that the Chancellor announced at spring budget, some £3.45 billion in technology to drive forward progress in the NHS, a plan I note the opposition hasn't supported.
Rachel Maskell.
Thank you, Madam Deputy Speaker. Can I take this opportunity to thank all NHS staff for their dedication, professionalism and care, which is really quite extraordinary in the light of the circumstances they face. I've had 30 years working in and around the NHS, and I know how the NHS was on its knees in 96, 97, and then that Labour government made such a difference, and yet nothing compares to the state of the NHS today. In particular, I think around NHS dentistry, where my constituents have to wait 7 years for an NHS appointment. I know my right honourable friend will be meeting with the dentistry community on the first Monday, he said, of coming into office, and yet the Secretary of State has not adopted the plan which would have worked, produced by the Health and Social Care Select Committee. Can she say why she didn't adopt that plan in full, and what she will say to my constituents when they go to the polls to vote for a service that works as opposed to a service which is so broken?
Hear, hear.
Well, may I, in fact, join the Honourable Lady in thanking her local NHS staff and indeed across the country. The NHS employs more than 1.3 million people, and every single one of those people contribute in their own way, from clinicians through to nurses, through to hospital porters, through to administrative staff. They all play a really important part in keeping us well and safe. In terms of the picture she seeks to paint, I mean, I hope she has the graciousness to acknowledge that we have, in fact, increased. We are diagnosing more cancer cases and we are diagnosing them more quickly at stages 1 and 2. I hope she will acknowledge, for example, that some 9 out of every 10 patients are treated within 31 days of a decision to treat with cancer. I hope she'll acknowledge that actually the average waiting time on the NHS in England, not Wales, is just under 15 weeks. Of course there is more to do, but we have plans in place to deal with this. And again, I would urge her to look with care at our dental recovery plan, because we have already seen more practices opening up to provide more NHS appointments, and as this recovery plan is rolled out, we will see up to 2.5 million more appointments, which is roughly 3 times what the Labour Party's plans on dental recovery are. Compare and contrast.
Simon Clark.
Speaker, and let me add my own best wishes for your retirement. I hope it's a long and happy one. I thank my right honourable friend for her statement, and as waiting lists continue to fall, which is fantastic, it's vital that we continue to boost access to primary care. So will she join with me in welcoming the news that the excellent Garth surgery in Gisborne, my constituency, is in the process of seeking to expand to bring out 6 new consulting rooms and create more space for recruiting GP registrars?
And may I thank my right honourable friend. He there is showing what is actually happening on the ground, rather than some of the relentless doom and gloom that we hear opposite. There are some really good examples in our local areas of people not just enjoying working in the NHS, but thriving in the NHS. And indeed, his GP practice will be one of the practices that have contributed some 60 million more appointments, GP appointments, in the last year. That was an election promise made in 2019. It's an election promise we have kept. And just to explain the maths to the party opposite, that means more than 1 million primary care appointments each working day. That is something that we should all be proud of and thank our GPs for.
Chion Wara.
Thank you, Madam Deputy Speaker. And can I also say how sad I am that whatever the result of the general election, they will not bring you back to the place that you so wonderfully occupied.
Hear, hear.
Now, waiting lists, dental services, mental health services, clinical trials, workforce morale, cancer care, innovative treatments, childhood obesity, whatever the measure, the Tories have failed us on health.
Hear, hear.
Is she really asking the people of this country to vote for 5 more years of Tory failure when they can vote for the change that the health service and indeed the country so desperately needs with Labour?
Hear, hear.
I would gently remind the Honourable Lady that her leader is a former barrister, and I declare an interest, so am I. And we used to, in the old days, as barristers, rely on the evidence. And the evidence that the leader of the party opposite relies on is that produced in Wales. He says this is a blueprint for what will happen in NHS England. My goodness me. As I have already said, we see 1/4 of people on an NHS waiting list under Labour-run Wales. We see the highest number of patients waiting 2 years in Labour-run Wales. We see patients waiting on average 6 weeks longer in Labour-run Wales than in England. And I'm genuinely surprised that the honourable gentleman opposite, who I have a lot of respect for, having been in post so very long as he has not been able, I don't know, to influence or to direct his Labour colleagues in Wales to follow his ideas if he thinks they're so good. That isn't working.
So Conor Burns.
Can I add my best wishes to you as you become one of the members of this place who voluntarily chooses to leave the House of Commons in the coming weeks? And can I say advisedly, I wish you all the best as you leave this chamber of Parliament. Can I take my right honourable friend, the Secretary of State, back to the subject of her statement, NHS Update, and tell her that I visited Poole Hospital on International Nurses' Day recently to see the amazing new barn theatres, which are part of the huge investment that is going in to the NHS in Dorset. When we talk about the money that we are putting into the National Health Service, it often seems to the public as statistics. In Dorset and in Bournemouth, we're seeing, with the new barn theatres in Poole, as part of it becoming the primary elective part of the local NHS, we're also seeing the 250 million total investment yield the beach building for births, emergency, children's care, etc. These are real investments that, apart from the outbreak of hyperbole, which I confidently predict we'll see more of in the coming weeks, that sadly we have not been able to cure in the last 14 years, are tangible examples of this government's commitment to deliver in the front line.
I'm delighted to hear that, and also to say that on my travels on Thursday of last week, I had the great pleasure of visiting Dorset, and I saw for myself not just a wonderful community hospital in Shaftesbury, but also the brand new A&E unit that is being built in Dorchester, thanks to the hard work of the local trust there, but also government investment to ensure that that hospital, that important hospital, alongside the hospital that my right honourable friend describes, that people in Dorset are getting the care they need in a modern way. That is the modern National Health Service as we as Conservatives see it.
Jeremy Corbyn.
Thank you, Madam Deputy Speaker. Is the Health Secretary not concerned that the undermining factor of the private sector in the NHS means that we are spending a great deal of money? £11 billion in 2022 was paid to the private health sector by the NHS. Many hospitals are spending 15% of their budget on paying for PFI contracts. Does she not think that we could save an awful lot of money by concentrating on expanding the NHS workforce? Their loyalty, their dedication, their efficiency are far better and far greater than the atomisation of our services into a myriad of private sector providers. It's more efficient to provide it publicly and cheaper and gives a better service to everyone.
Let the record reflect this is a rare moment of agreement between me and the honourable gentleman in that the PFI contracts signed by the previous Labour government have been an unmitigated disaster for our hospitals, for the ICBs and others who are trying to fund them. And they drafted the contracts so incompetently that we cannot leave them without massive, massive cost to the taxpayer. That is the real cost of Labour-run private finance initiatives. But in terms of, I then part company with him on the role of the independent sector. We already rely on the independent sector to the tune of some 10% with electives. I want to see our residents treated as quickly and as well as possible. To my mind, the independent sector must play a role in that, an important role, and indeed we as Conservatives want to make it even easier for patients to choose where they get their treatments, so that they get their treatments more quickly and they get them in they have the quality of service that they want. So I don't know whether the right honourable gentleman will be here or not after the campaign, but we have at least one area on which we have agreed, namely PFI.
Order. I'm extremely grateful for all the terribly kind comments, which means I'm a bit reluctant to say this, but I think we do need to crack on. So I would ask for brief questions and brief answers. It appears the whips are agreeing with me. I think they know that we do have the business statement and then the finance bill to get through as well. Good example of this will be Sir Christopher Chope.
Speaker, thank you for giving such a good example, as always, to this House. My right honourable friend was kind enough to meet me and our right honourable friend, the member for Kenilworth and Southern, to discuss the plight of those people who are victims of COVID-19 vaccine damage. And she sounded very sympathetic at the meeting and promised to look into the vaccine damage payment scheme. So it was rather disappointing this week to be told, in answer to a written question, that formal consideration of whether any reforms to the VDPS are necessary will form part of Module 4 of the COVID-19 inquiry. That won't be heard until January next year, and it smacks of sort of kicking the can down the road and delay in ignoring the victims who need help. And the sums paid, the £120,000, hasn't been increased since 2007.
Authority is draining away. So I'll make another plea for brief questions. I thought the right honourable gentleman was going to set a superb example. However, Secretary of State will now respond, I'm sure, briefly.
I very much still share those concerns. I will take away what he has said, but I do very much want to look into this because I do understand the points that he and our right honourable friend has also raised.
Helen Hayes.
Thank you very much, Madam Deputy Speaker. The Secretary of State comes to this House at the end of a Parliament to paint her government's record on the NHS in the most positive possible light. I have to say to her, the picture she paints will not be recognised by staff working in the NHS or patients anywhere in my constituency. And I give her this example. It is impossible for constituents at some GP practices in my constituency to get an appointment in a timely manner. At the same time, our local hospital, which is under very severe financial pressures, is reporting record numbers of patients attending their urgent care centre because they can't get an appointment in primary care. Will the Secretary of State acknowledge her government's failure to tackle primary care, which is placing unbearable pressure on doctors working in our hospitals to do the best for their patients?
Again, Madam Deputy Speaker, I pay tribute to our general practitioners and all of the staff that work with them in practices, because we know that they have delivered some 60 million more appointments than in 2019. That was an election promise made and kept. But in terms of her wider question about primary care. This is precisely why we have rolled out, for example, Pharmacy First, because that will free up GP appointments. It is precisely why we have a focus on prevention, because we know that if we can help people through the NHS app, that again will take the burden off GPs. It's also why we are looking in an imaginative and thoughtful way at fit notes, because I very much have listened to and heard GPs who say if we can reduce these sorts of responsibilities on GPs, that will leave them for more time for patients.
Deputy Speaker, I'd like to thank my honourable friend for her support in making sure that my CDC in Rochester will have that extra funding so that the MRI scanner is secured. That's going to make a big difference to my local community. As she knows, I've been working with the hospital and having conversations around my campaign for a second site hospital for Medway. I'm asking my right honourable friend if she could possibly have some conversations with her colleagues in DLUC. We have a Homes England government-owned site on the Hoo Peninsula, absolute prime for a second site hospital. The Medway Council are doing their local plan. It's imperative we have that site as a health site rather than a housing site.
I thank my right honourable friend, who has been such a firm campaigner on these issues. I mean, any constituent would be, I think, I should be very pleased with everything that my right honourable friend has done to press upon me the importance of this, but also actually the fact that the Community Diagnostic Centre is opening and will be providing more tests, checks and scans for her local residents. I will very much take up those conversations, and I am very much looking forward to coming to visit her in the next Parliament to celebrate the openings of those centres.
Sir Chris Bryant.
Dame Rosie, in the words of South Pacific, if we ain't got dames, where would we be? In November 2021, Boris Johnson and the Right Honourable Member for Bromsgrove appointed me to co-chair a programme board to create a national strategy on acquired brain injury. This matters in every single one of our constituencies. We're still failing, I'm afraid. It's not been possible to put that together, and despite the months that have passed, for a whole series of reasons, including churn of ministers and the fact that the government isn't able to put a single penny into it, not even enough money to check how many people suffer a brain injury every year. So can I just ask the Minister, this is a cross-party issue, how can we make sure that later on this year, whoever forms the government, we really do end up with a national strategy for acquired brain injury, so we don't just save people's lives when they've been in a road traffic accident, we give them back the quality of life and independence that they so dearly deserve?
Well, may I thank the honourable gentleman, and I know that he has been working very closely with Minister Stevenson on this. He will also remember, actually, the cross-party working that we had when I was taking the domestic abuse bill through the House and our concerns about female prisoners and the disproportionately high rate of ABI that we see in female prisoners. I will very much take away his thoughts. He'll appreciate over the campaign I may not be able to enter into detailed discussions with him on this, but I very much look forward to continuing those discussions from this dispatch box in 6 weeks' time.
Brine.
Your service, Madam Deputy Speaker. A long time ago, I was a medical student, and improving access to general practice is really important for me. Now, I'm proud that the record funding that we've put into the National Health Service has enabled us to have not just 50,000 extra nurses, but 56% extra clinical staff in GP surgeries in my constituency. Now, our GPs, the average surgery is doing 44 appointments extra every working day compared to the start of this Parliament. But an ageing society means more and more pressure. So what is the Minister doing to take the pressure off with things like Pharmacy First?
May I thank my honourable friend and thank him also, not just for his early commitment to the medical profession, but also, of course, for his work as a health minister. He did so much to help prepare the dental recovery plan. I am so grateful to him for all of that work. In terms of his question about prevention and the scale of demand on the NHS, he is absolutely right. And one of the pieces of work that we are trying to bring together is to look at patients as a whole person rather than as individual conditions, because we know as we age we will be developing more conditions and living with more than one condition. And so part of my work to reform our NHS to make it faster, simpler and fairer is to ensure that we're living longer, healthier lives and concertinaing that period of ill health towards the very end of life, so that not only is it better for us as individuals and for our families, but also better for society and, of course, the NHS.
Chris Webb.
Thank you, Madam Deputy Speaker. In the first few weeks I've been the member of Blackpool South, many of my constituents have contacted me about the lack of NHS dentistry in the town. No NHS dentist is taking on adult patients, and children are forced to our local A&E with tooth decay. Correct. This is a huge issue in our town with so many other troubling issues. So will the Secretary of State finally admit that this government has let my constituents down, and that only under a Labour government will we get access to the dentistry we desperately need?
May I welcome the honourable gentleman to his place and to say to him that Blackpool has a very special place in my heart because I went to school there. Indeed, I could hear the cheers from the Big Dipper and the Pepsi Max from my classroom. And so it is towns like Blackpool and indeed Mablethorpe in my own constituency, as a coastal town as well, that I very much had at the forefront of my concerns when we were looking at how we could help some of those dental deserts. It is why I have been so focused on getting dental vans into tender so that we can try to push out some of these services. They are not a permanent fix, but they will help people in the short term whilst we're building up new practices through golden hellos and the such like. And of course today we've had the announcement of the consultation for dental graduates, because we would like, if we've contributed, the taxpayers contributed to their training, we would love for them to have experience on the NHS as part of their training and their experience.
Mumby Croft.
Speaker, can I thank my honourable friend for arranging for Minister Stevenson to come to Scunthorpe Hospital. We were absolutely delighted to show him our brand new A&E, our ambulatory care unit and the renovated wards that have been now completed. She will also know that we're midway through our community diagnostic centre, which we're also really looking forward to getting up and running. Could she confirm that she is aware of my campaign to ensure that that small number of services that the hospital are indicating they may wish to move to Grimsby remain in Scunthorpe? It may only be a small number of patients, but it's incredibly important to those patients who are affected. I know she can't influence it at this point, but will she acknowledge the very great strength of feeling that we have on this issue?
Only as my honourable friend devoted her career in this place to representing the steelworkers in her constituency, but also to her constituents' healthcare. And it is thanks to her campaigning and those of other colleagues that we have a CDC and facilities like that in her local area. She has very tactfully described my position. I, of course, acknowledge my awareness of her campaign, and I really look forward to working with her in the future to see if we can ensure that the residents of Scunthorpe and the residents of Grimsby have those services that we all hold so dear.
Speaker, can I thank the Secretary of State very much for her statement. It is clear that the NHS is, in some cases, in need of critical care, and whilst we all prepare for an election, there are ill and vulnerable people unable to prepare for surgery and treatment they so desperately need. So how will the Secretary of State ensure that whilst this Parliament dissolves, the NHS continues to consolidate and grow and delivers a much needed diagnosis and operations that our patients and constituents?
Well, may I thank the honourable gentleman, and it has been one of the joys of this Parliament is to have him contributing in every statement and debate. In terms of the particular healthcare needs in Northern Ireland, he'll appreciate that they are devolved and that we are all very mindful of the recent history in terms of the devolution of power in that particular set of circumstances. But I have very much enjoyed working with the Health Minister, Minister Swan, and we will try, clearly, we value our United Kingdom. We want to do whatever we can to help all corners of the United Kingdom in healthcare, although, of course, we respect they're devolved. And this is why not just do I want to work closely with my counterpart in Northern Ireland, but I have also indicated that I would be very happy, or I am indicating now, I'd be very happy to work with the health ministers in Scotland and in Wales to help them with their waiting lists.
Rob Butler.
Madam Deputy Speaker, this Conservative government has invested hugely into the NHS. Doctors are working extremely hard, but because of the very rapid growth of Aylesbury, unfortunately there are still many local residents who have to wait too long to get an appointment. Innovative ideas like Pharmacy First and health hubs on the high street are already undoubtedly helping, but I believe we can do even more, which is why in this election I am campaigning for a permanent walk-in health centre in the heart of the town, a one-stop shop where people can go for check-ups, see a nurse, physio or paramedic and receive expert medical advice and support. Does my right honourable friend agree? This is exactly the sort of clear plan for bold action that will secure the future of our NHS.
Stay. I most certainly do, and it's a pleasure to hear actually that my honourable friend, who is such a great campaigner in his constituency, has that as a clear target for his area and to represent his constituents. In terms of the recruitment of general practitioners, we have set out through our long-term workforce plan our ambitions, but importantly the plans and underlying those ambitions to ensure that we are recruiting even more doctors, even more nurses, even more midwives, even more dentists and so on, to ensure that we are building the NHS of the future. And he may want to share this fact with his constituents that since 2010 there are more than 41,000 more doctors in our NHS in England and more than 73,000 nurses. They are figures to be proud of.
Caroline Johnson.
Madam Deputy Speaker, and I would like to associate myself with the good wishes that have been sent to you this morning. Prevention is, of course, better than cure, and this government has introduced world-leading legislation, the Tobacco and Vapes Bill. Can my right honourable friend confirm that she's doing all she can to ensure that it's passed during the wash-up? She knows of my concern for children and their exposure to vaping. If it's not able to pass during wash-up, could she confirm the Conservative government would act quickly once re-elected to protect our children from deadly nicotine addictions?
I'm very grateful to my honourable friend, indeed my honourable friend who, of course, brings her professional expertise into the chamber. In terms of the bill, she will appreciate it's a very delicate stage at the moment. I'm not allowed to say anything at this dispatch box, but she should be absolutely confident of the commitment I have and the Prime Minister has to this important legislation and to a smoke-free generation.
Greg Smith.
Thank you, Madam Deputy Speaker. Buckinghamshire has seen significant improvements to the NHS estate, not least with a new paediatric A&E at Stoke Mandeville Hospital. But my right honourable friend will know we've had many conversations about getting a new primary care facility into the village of Long Crendon and critical upgrades to Wickham Hospital to replace the ageing tower. So can she confirm that a future Conservative government remains absolutely on track to deliver on those facilities?
I am delighted to not just support my honourable friend, but also to commend him for his campaigns. This Conservative government is committed to building the facilities we need in the National Health Service, and it is a pity that the Labour Party doesn't seem to be in the same place.
Anna Firth.
Speaker, I want to thank the Secretary of State for visiting Southend Hospital last month. She knows when I was elected, ambulance handover times in Southend were the worst in the region. They're now often the best, and the emergency village is helping thousands of residents. She also helped launch the first trust-wide fracture liaison service in the UK in Southend that will save thousands of fractures, millions of pounds and thousands of bed days. So would she join me in congratulating CEO Matthew Hopkins, COO Andrew Pike and consultant rheumatologist Dr Wei Main Wong on this life-transforming service?
Yeah.
May I say how delighted I am to see my honourable friend back in one piece, given her abseil down the hospital recently, and also to say how much I enjoyed seeing the confidence, the ambition and the professionalism of the new services being provided by her local hospital. I hope she is pleased that I have confirmed today that the government has the ambition to expand the use of fracture liaison services to every ICB in England, achieving 100% coverage by 2030, very much inspired by her hospital.
James Wilde.
Madam Deputy Speaker, since being elected to represent North West Norfolk, I have campaigned with strong local support for a new hospital. So can my right honourable friend, the Health Secretary, confirm that it is only this Conservative government that is committed to building a new Queen Elizabeth Hospital in Kings Lynn by 2030 for patients and staff as part of our fully funded plan?
May I thank my honourable friend, and I very much understand and acknowledge his campaigning on this. Yes, we want to ensure that his county have the modern hospital facilities that they need. I note in passing that, of course, in the Norfolk and Norwich Trust, we will this summer be seeing the opening of more surgical capacity precisely to help deal with some of those waiting lists that we see in his county. This is positive, practical action to secure a bright future for his local NHS.
Louis French.
Thank you, Madam Deputy Speaker. My right honourable friend will be aware of the incredible work that the late James Brokenshire MP did for Old Bexley and Sidcup constituents, but particularly with Queen Mary's Hospital in Sidcup. Building on James's legacy, I've been proud to work with her department, Oxley's NHS and other partners locally to deliver new services for all patients in Old Bexley and Sidcup. But will my right honourable friend join me today in thanking all of the team and all the staff at Queen Mary's Hospital in Sidcup? And will she join me in thanking particularly the project team that are working very hard to deliver the new community diagnostics hub, which will open in Old Bexley and Sidcup in early next year? Thank you.
Well, again, I'm delighted to join my honourable friend in thanking the staff in his local area supporting that very important hospital, but also the confidence and the ambition for his local area through the opening of that community diagnostic centre. He's going to see more constituents being diagnosed and getting treated more quickly because of the investment that this government has put in to that centre in his constituency. So I thank all of his staff and particularly the project team.
Thank you very much, Dame Rosie, and I thank you for your service to this chamber. Will my right honourable friend recall the conversations we've been having about a community diagnostic centre in South Derbyshire, where we do not have one, we don't have a hospital, everybody has to travel? Could I invite her, not only during the 6 weeks, but after the 6 weeks, when she's back at that dispatch box and I'm back here, to come and visit us and talk to the great teachers, the doctors and the nurses that want to put this project together?
That is an irresistible invitation, if I may say so, and I will very much look forward to visiting her constituency to support her in her campaign for a community diagnostic centre. And if I may, I think we're on the last question, are we, Madam Deputy Speaker? We are. Can I just, as we enter into this general election period, may I give my very sincere thanks to every single member of our NHS staff, to every single person working in social care across England. You all do amazing jobs, and it is my great privilege to serve as your Secretary of State, and I wish everybody a very calm, not quiet, calm 6 weeks. The medics will understand what I mean by that.
On that note, I thank the Secretary of State for the statement, and once again for those who've made very kind comments. And